On the evening of March 4th, 1990, Hank Gathers, a 23-year-old forward for Loyola Marymount University, took the ball on a fast break during a West Coast Conference tournament game against Portland, rose for a dunk, and on the way back down the court simply collapsed. He had collapsed once before, in December of the previous year, and that first episode had been enough to get him into a cardiac catheterization lab, where doctors diagnosed a thickened, stiffened heart muscle obstructing blood flow out of the left ventricle, a condition then usually called idiopathic hypertrophic subaortic stenosis, now understood as a form of hypertrophic cardiomyopathy. They put him on propranolol, a beta blocker meant to slow his heart and reduce the force of each contraction so the thickened muscle wasn't straining against itself. He hated it. It made him sluggish on the court, cost him energy. He needed to play at the level that had made him one of the most electrifying scorers in college basketball. And over the following weeks, his dose was reduced, first by his cardiologist, trying to balance safety against performance, then further by his own choice against medical advice. On March 4th, his heart, thickened, scarred, electrically unstable, went into a fatal arrhythmia in front of a crowd of people trying to cheer him back down the court, and he never regained consciousness. The autopsy, released 10 days later, confirmed what the cardiologist had feared: a heart enlarged well beyond normal limits, its walls thickened, patches of scar tissue running through the muscle where cells had outgrown their blood supply and died in slow motion over months or years. What killed Hank Gathers at the cellular level was hypertrophy, the same basic adaptive process that lets a competitive weightlifter turn a modest bicep into a considerably larger one after months of progressive resistance training, except turned pathological and unopposed. Hypertrophy is an increase in the size of individual cells, producing an increase in the size of the tissue or organ as a whole, and it happens specifically in tissues built from cells that cannot readily proliferate. Skeletal muscle, cardiac muscle, and neurons are the classic examples. These are permanent cells, arrested in the G0 phase of the cell cycle, essentially unable to re-enter mitosis and divide in any physiologically meaningful way once they have terminally differentiated. When the workload placed on such a cell increases, resistance training in the weightlifter's biceps, chronically elevated pressure or volume load in a diseased heart, the cell cannot respond by making more of itself the way a liver cell or a skin cell could. Its only option is to get bigger, to synthesize more contractile proteins, pack in more sarcomers, more mitochondria, more of whatever machinery the increased workload demands, and grow. In the weightlifter, this is entirely physiological. The stimulus, training load, is proportionate. The growth is reversible if the stimulus is withdrawn, and the enlarged tissue is structurally normal, just bigger and stronger. In a heart laboring against outflow obstruction from a genetic mutation in a sarcomeric protein, the stimulus never really goes away, the growth is not proportionate or protective in the same way, and the thickened muscle becomes progressively less well supplied by its own coronary microvasculature relative to its size, setting up exactly the kind of patchy ischemic scarring that turned up on Gathers' autopsy table. The muscle is trying to adapt to a demand it cannot actually satisfy by growing, and the growth itself becomes part of the pathology, a stiffened, poorly compliant chamber, a disorganized arrangement of muscle fibers at the microscopic level, and an electrically unstable substrate that predisposes to the kind of fatal ventricular arrhythmia that killed him on the court in front of a stadium of people. Hyperplasia is the other route to a bigger tissue, and it is available only to cells that retain the capacity to divide. And it works by fundamentally different logic, one best illustrated by a patient whose adrenal glands, rather than her heart, had outgrown their normal proportions. Cushing's syndrome describes the clinical picture that results from chronically excessive cortisol, and one of its recognized causes is a pituitary or ectopic tumor secreting excess adrenocorticotropic hormone, ACTH, which drives the adrenal cortex to enlarge, not by its existing cells getting bigger, but by an increase in their actual number. The cells of the adrenal cortex retain full proliferative capacity, and under sustained ACTH stimulation, they respond by dividing, producing a genuinely hyperplastic gland, enlarged but composed of a greater number of essentially normal cells, each one still individually unremarkable, still responsive to the signal driving the process. Hyperplastic growth remains regulated. It is a response to a specific, identifiable stimulus, and take the stimulus away, remove the ACTH secreting tumor, correct the underlying drive, and the hyperplastic tissue can, at least to a meaningful degree, regress. Neoplastic growth, by contrast, is uncontrolled and autonomous. It has broken free of the signal that was supposed to be governing it, and it continues to proliferate whether or not the original stimulus is still present. The full anatomy of that distinction, how a benign neoplasm's growth rate, its capsule, the sharpness of its margin, and its total lack of metastatic capacity differ from a malignant one's, belongs properly to the story of cancer biology itself, and gets told in its own right elsewhere. For now, the point is narrower and more foundational. A hyperplastic gland answers to something outside itself. A neoplasm, sooner or later, does not. What connects Gather's heart and the Cushingoid adrenal gland, despite their utterly different clinical stories, is the same underlying architecture of the problem. A tissue under sustained demand has exactly two structural options for getting bigger, and which one it uses is dictated entirely by whether its constituent cells have kept the ability to divide.